This horse we can see is standing with the left forelimb semi-flexed, with a weight only on the toe. This is what we call the root signature posture, and it is absolutely pathognomonic for cervical nerve root impingement. And in association with that, there is often focal allodynia, that is hyperreactivity to light touch, as indicated by the yellow star. This type of lameness may be induced by alterations in head and neck position. With this horse, it would only show this lameness if it was worked for a period of time, absolutely on the bit. And it was not an easy horse to work on the bit. In other horses, it may be induced by landing after a jump, when the neck extends and there is the potential for narrowing of the intervertebral foramina and therefore nerve root impingement. While showing clinical signs, the horse may bend the neck away from the side of the lame limb, with or without a head tilt, with or without focal sweating. And dramatic as though this is, this lameness may resolve spontaneously within 10 to 15 minutes of its onset. Idiopathic, hopping type forelimb lameness can also be episodic in its nature, particularly in mild cases. It may occur repeatedly during an exercise period with periods of normality, or in some horses it will only be apparent on specific days. This horse is showing pretty obvious signs of a right forelimb lameness associated hopping type lameness. We will see that the horse will progressively lower its head now and take some completely normal steps, and its facial expressions and its demeanor completely change. Sometimes owners do not recognize this as lameness. They feel as though the horse wants to break spontaneously to canter, and they assume that's all it is doing. And then clinical signs are recurring in this horse. The head goes down as the non-lame limb bears weight, and goes up extremely so when the lame limb is brought forwards. Aortoiliacofemoral thrombosis is a cause of episodic lameness. It can occur in any type of horse, and there may be no preceding clinical signs. It may induce a unilateral or bilateral hind limb lameness. This horse, depicted in the video, has had 3 episodes of acute onset, severe right hind limb lameness in the last 6 weeks. The work duration required to provoke clinical signs is very variable among horses. This horse moves rhythmically, both in hand and on the lunge, with no evidence of overt hind limb lameness.